All right. So for the next hormones, which we'll be picking to look at their function in stress, I'll be picking two hormones that usually work side by side. All right. So we'll be picking glucagon, which is a hormone that usually encourages for the storage of carbohydrate. They'll be picking insulin, which is a hormone that encourages breakdown of carbohydrates. You understand? So let's go. So glucagon and insulin, let's always put them in that order. So they are secreted by the alpha and beta cells of the pancreas respectively. Stimulators for glucagon include if the blood glucose levels is down. All right, so you want to now encourage storage of glucose. So hypoglycemia, protein ingestion, amino acid infusion, endorphins, exercise, growth hormone, epinephrine, cortisols. All of these are stimulators or triggers for glucose. Then suppressors, like what will actually suppress glucose, glucagon release. Of course, anything suppressing glucagon release will be encouraging insulin release. Do you understand? So anything we spoke here is actually opposite. Stimulators for glucagon are inhibitors for insulin. You get, like I told you guys, that they are actually totally opposite hormones. So suppressors for glucagon is if you already have a lot of glucose, there's no need for glucose storage. Somatostatin, and if you give insulin, or if there's now secretion of insulin, once insulin is being secreted, glucagon has to go and hide. So glucagon, just like I told you guys, it encourages storage of glucose. So it promotes hepatic glycogenolysis, increases gluconeogenesis from amino acids in the liver by increasing hepatocyte count, and has a lipolytic activity, breakdown of lipids. Right? So insulin majorly acts in opposition. Like I was telling you guys, they are directly opposite. If you understand the roles of glucagon, just turn it opposite. Those are the roles of insulin. So insulin majorly acts in opposition to glucagon. But note that somatostatin inhibits both insulin and glucagon release. So following injury, glucagon is elevated while insulin is decreased. That's following stress response. Alright? Glucagon will be increased, insulin will be down. Because you need a lot of glucose so that your body can keep up with wound healing and adjusting to the stress and all of that.